disorder outpatient treatment program. And my function today will be to announce the speakers. Today's program is unique in that it's a program that was not conceived by the staff, but conceived and developed by the Vietnam Veterans Hootch group. As we know, no matter how well we plan something, we need cooperation and support of all those people in our center. And one of the individuals that has been very supportive to post-traumatic stress disorder treatment program in the Vietnam veterans is our director. So without much more, I'd like to take time to publicly thank him and introduce him to you, Mr. James Farcetta, Director of the Brooklyn VA Medical Center.
Thank you and good morning. It's nice to see the group here. We're hoping that the room will fill up a little bit later on. It's a Saturday morning. Sometimes it's kind of tough to roll out of bed, especially when it's the first cold Saturday morning and those sheets are so nice and warm and comfortable. I think that we owe a thank you and a round of applause to our Hootch group for putting this program together today. So for the fellows who put it together, being the Chief Executive Officer of this institution has both its rewards, and I don't want to use the words, and its punishments, and I'll discuss the rewards. And basically the rewards is, despite what people may think, that people who run institutions are really only as good as the people who support them. And I'm particularly proud of the Hootch group here, because the Hootch group not only supports me in terms of public relations and what it is that we do here at the Brooklyn VA Medical Center, and I think our efforts for veterans in general are by and large spectacular. I think our efforts for Vietnam veterans and PTSD and our outreach and our substance abuse are really second to none. And I think we have something very unique here, and the uniqueness of it is that we allow the veterans to take part and to do, and I would like to think provide direction, but sometimes I'm not sure that the direction really isn't provided by the group. What you see here today are the collective efforts of staff and veterans to make something like this happen, and it may look relatively easy, but by no stretch of the imagination is it easy. Our Hootch group is something that I'm very pleased with. I spent a week in Washington, and I'll steal a line from someone last night after listening to a number of politicians. It's always a delight to get back and realize what it is that we do and appreciate the people who do it. I was struck by something that I read in the newspaper, and it's really a contrast. You don't see the media here today to cover what it is that we do, nor do you see the media here when our Hootch group does little things like fingerprinting children for the police department or running a voter registration drive. But you'll see the media when a Vietnam veteran burns an American flag, and that somehow gets a lot of attention, which I really think is unfortunate, because there's, I think, still in some instances a stereotypical view that is portrayed to the public, which I think we need to get away from. And I think efforts like we do here in Brooklyn and we're doing here today is what we really need to do to capture the attention of the American public. The program looks terrific. I think we have a lot of excellent speakers. I think we're going to be hitting on a number of topics, maybe not all topics, but a number of topics that should be of interest to each and every one of you, whether you're a veteran, whether you're a healthcare professional, or whether you're someone who really wants to be more informed about the post-traumatic stress issues and issues that are confronting Vietnam veterans. I welcome you here. Maybe if you have an opportunity, you can get some of the ladies and gentlemen to take you around the building. I'm very proud of this institution. I'm very proud of what we do. Maybe they can take you up to the 5th floor to show you where the group's environs are, or they can take you around the building and show you what it is that Brooklyn VA Medical Center has to offer. Thank you very much, and enjoy the day.
Next, we will have the Chief of Psychiatry, Dr. Aerthur Sinkman, and he will give you a workshop overview.
It's my pleasure to be here, and I struggled, like Mr. Farcetta said, with getting out of bed this morning and getting here, but we're here. And we have a wonderful schedule today, and we have a lot of very interesting speakers, and I'm going to give you a brief overview of them. But before I do, I wanted to just tell you something about the whole Hootch group and the program here. In psychiatry, our big guru, Sigmund Freud, made a very important point about treatment, and he stressed this a great deal, and that what he called the alliance between the patient and the therapist was of utmost centrality to the treatment. And what he meant is that psychotherapy is not done by the doctor or by the therapist to the patient, like in surgery where you just you get your anesthetic, you lie there, and the doctor does the work. In therapy, it's a combination of the therapist and the patient working together. And most of the work really in reality is done by the patient, who must work hard to try to figure out what's going inside his own head. And when he learns those things, to make the necessary changes after the sessions. And I think it's really important that the patient work very hard to change himself and get better. I don't think Freud had in mind the Hootch group, but in fact I think the Hootch group is a prime example of the patients helping themselves. And the fact that we have such a wonderful, elaborate meeting today organized by the Hootch group, and actual members of the Hootch group will be speaking. The next speaker is Mac Bika, who's the president, or I think that's his title, in the chairman of the group. Attest to the fact that that this is really an alliance between Mac and the other members of the Hootch and the staff working together to get better. And I encourage everyone here to really think about what Freud said and to try to work hard to help themselves. And I think through that there will be great changes within each one of us. The first speaker in our list today will be Mac Bika, who's going to be talking about certain aspects of the Vietnam experience and how that was different than other past United States conflicts and our different wars, and how that affected the psychiatric problems and difficulties that Vietnam-era veterans experienced. Following that will be Herb Stein, who's the psychiatrist in charge of the PTSD program. He's going to be talking about some aspects of post-traumatic stress disorder syndrome and different things that people can develop as a result of combat and their experiences. After that, we're going to be having some other very interesting clinical talks by experts. But that's not going to be our only part of the schedule. We're also having other people coming in, not just therapists to talk about you people, but we have someone coming here to talk about Agent Orange, someone coming here to talk about rights, and Dan Friedman will be here, who's going to be talking about the different programs you can avail yourself of. So I think we have a really excellent program, and I'll mention some of the speakers. Dr. Phil Say is a research psychologist on our staff who's been doing very important research on the effect of the Vietnam experience on families. We'll be talking. And our keynote speaker was Aphrodite Matsakis. I hope I'm pronouncing her name correctly. And she's going to be coming up from Washington. She's a veterans employee. But when I say employee, I really should stress the fact that she's a clinical psychologist. She's written a book on this area, and I understand it's really wonderful. And we've gotten some brochures, and perhaps she'll have some to show you here today. I try to stress the fact that the patients here in the Hootch have made a real self-help kind of activity, but I think we can't downplay the work done by the staff. We have a very dedicated staff. One of the founders of the PTSD program here, my predecessor, Dr. Kiersman, is no longer here, but I understand, and Barbara just told me again this morning that he was very instrumental in bringing this program here. He's gone, but the staff has been here since, besides Barbara Simmons, who works in the program. We have Dr. Stein, who will be here soon, who's besides working here, he's also a very well-known and respected psychoanalyst in the New York psychoanalytic community. And in addition, our social worker, Gene Albello, who's extremely skillful and an expert. And I think altogether we have a wonderful team that works with the patients so that the patients can help themselves. And I hope that you enjoy the meeting today and that we all together have a good time and learn some new things. Thank you.
Thank you, Dr. Sinkman. Our next speaker is Mac Beaker. Mac Beaker